There's so much that the mouth is responsible for. It's not just aesthetics, it's not just for smiling, it's not just for chewing, it's also for phonetics. It's an important part of your digestion. And so people are missing out a whole lot when they're missing a number of teeth. An implant is nothing more than an anchor that goes under the gum line into the jawbone, and you can attach pretty much whatever you want on top of that. That can be a single tooth. It can be a ball attachment, kind of like a trailer hitch, so that if you have a removable prosthetic like a denture, it'll click in place and stay put. To a full mouth of implants, usually that's called the all-on-4. 4 implants are placed and a fixed bridge work is attached, and it is like having teeth again. It restores you closer to 100% what it's like having all of your teeth. A denture is closer to 10 or 15% of your overall chewing ability. They're unstable, they move around, they're loose, they'll float up, and sometimes even come out during speech. I can't imagine what it would be like to lose your teeth while you're talking to someone. I think that that's something that really affects people's confidence, and it's one of the major driving forces for people who come in and see me for all-on-4 implants. So we try to keep everything under one roof. We have the CT scanner in-house. It's just down the hall. We have in-house laboratory, 3D printer. And with all that, I'm able to micromanage the entire process and make sure that things proceed according to my timeline and my standards. Many patients have some anxiety about having an implant placed. It does sound a little rough having a tooth out and a titanium screw placed into the jawbone, but the reality is it's not too bad at all. It is a quick procedure for a single implant, many times around 20 minutes or so, and the after effects aren't too bad. Most people have a little bit of blood oozing afterward, very little swelling. Tylenol or ibuprofen would be appropriate for pain afterward, and usually it's just a day or two before they start engaging in their normal activities and a normal diet. Yeah, at most other offices, they have to send out to a laboratory, and it takes a week or two to get the temporary back. At Winn Dental Implant and Sedation Center, we have the Einstein printer, and we're able to turn it around in 45 minutes to an hour. Printed temporaries are made out of a resin that's reinforced with ceramic, so it becomes very durable and extremely strong. It's fully processed and cured so that there aren't a lot of chemicals that are leaching out of it. It's a wonderful material. I have patients that have asked, because this is being implanted in my body, is it like having someone else's organ transplanted into my body? Do I have to take anti-rejection medications? And that's not the case at all. For whatever reason, our bodies love titanium, and our bodies attach to titanium and accept it. There are very few cases of rejected or foreign body responses to the titanium. Very few people are allergic to titanium. It happens, but most of those people already know about it. So not all sedation is the same. There are a lot of offices that market sedation or sleep dentistry, and a lot of times it's nothing more than a pill that a patient takes and then some laughing gas. And so you are aware of what's happening during those procedures. You are technically awake. But my licensure expands to true sleep dentistry, where my patients are completely unaware of what's going on. In fact, I use the same medications that you would see in a hospital operating room. And I use the same monitoring equipment. It's the same level of care as general anesthesia for an operation. I love teeth, and I think that teeth are the gold standard. And if I can save your teeth, I'm going to. But a lot of my patients, they come in after having some kind of major life event. Many of my patients have recovered from an addiction. My patients have recovered from cancer or some other kind of medical condition. And this is like the last piece of the puzzle before they come full circle. And that's one of the most gratifying things about my job is that I get to see them on the other side and help them with the restoration and getting back to ideal health.